Christine and Maurice, it's essentially cyber blackmail we're talking about. Hackers take over the information and they won't unlock it until they get their money. If it's not paid, they threaten to destroy your data. It's a technique that has security experts scrambling tonight. The electronics emergency wreaked havoc on the UK health system, forcing hospitals to divert ambulances and turn patients away. By the time the hackers finished their massive hijacking, 16 hospital computer systems across Britain were compromised, and this heart patient's surgery was put on hold.
I was supposed to have a stent put in over the weekend, but they can't do it now because of all this computer hacking.
The attack involves a malicious software known as ransomware that infects a computer by turning data into gibberish. The information isn't unlocked until an actual ransom is paid.
This was not targeted at the NHS. It's an international attack, and a number of countries and organisations have been affected.
Computer problems were reported in nearly 100 countries, including Spain, Japan, Turkey, and the Philippines. In the U.S., FedEx was affected. The hardest hit was Russia.
Essentially, the entire internet has come under assault.
Alex Hyde of Security Scorecard in Manhattan says people who should be most concerned are those using outdated Windows technology, saying no one is immune to a ransomware attack.
Everyone's data is sitting on some company's computer somewhere, and that company is sharing it with someone who's sharing it with someone. It's just the way business is done. It only takes one of those companies within that ecosystem to have a weak link and be infected, and now that data is out the door.
And yes, there are things you can be doing right now to help protect your own computer from this kind of attack. Update the software on your computer system. Back up your data on your computers, both at work and at home. Don't open any emails that you're not expecting, and never click on a link or a file that is unfamiliar. Maurice?
Okay.